1 in 6 couples now find it difficult to conceive, and more are turning to fertility treatments. Yet many people are unaware that in both men and women, diet and lifestyle can help improve your chances of conceiving. In this film, Dr. Marilyn Glenville, a women's health expert specialising in natural solutions to infertility, explains.
Fertility problems can occur for a number of reasons. Problems around ovulation, blocked fallopian tubes, things like polycystic ovary syndrome or endometriosis. There can be also problems on the male side with poor sperm count or poor motility. Interestingly though, 30% of couples will have a diagnosis of unexplained infertility. Interestingly, a study by the University of Surrey showed that when couples changed their diet, put in nutritional supplements, looked at lifestyle, 89% of them are conceived naturally, even with a previous history of fertility problems. When we think of lifestyle factors, obviously you want to eat well. A good diet for both of you is really important. Caffeine can make a difference to women. It can make them take longer to get pregnant. It can also have an effect on sperm count for men. We're thinking of things like smoking and also alcohol. So it's important for both the man and the woman to look at what's going on in their lifestyle, improve their diet, but are there certain factors that could be actually making it either take longer to get pregnant or making it very difficult because it's having a negative effect on their fertility. Interestingly, when we look at the research on nutrients, there's a great deal of evidence now on how certain vitamins and minerals can improve fertility, both for the man and the woman, can improve the success rate of IVF, and really important to know that the evidence is there and to use that to give yourself the chance of conceiving naturally or improving the IVF success rate. We always think of folic acid, and that needs to be in any fertility supplement for women because we know it helps to prevent spina bifida. But there are others that are really key. The B vitamins especially, B6 has been shown to help with fertility for women and also B12 for men. And zinc is the most important mineral for fertility. It's the most important one for men. Really good studies on correcting zinc deficiencies, putting in zinc supplementation, increase in sperm count, really important mineral generally. Selenium we think of, which is a powerful antioxidant, important for both men but also important for women as well. So there are key antioxidants that need to be in there. The other two antioxidants are vitamin E and also vitamin C. They're important for men and they're also important for women, and for women especially if you're in the older age group where you may have low ovarian reserve. It's important that you're looking at the quality of your eggs, and that's what the antioxidants, the zinc, the selenium, the vitamins E and C do for you in terms of improving quality of eggs. And then we think of omega-3, and they're essential fatty acids that men need for important sperm health and also women for hormone balance. So omega-3s are important for both male and female fertility. I think tests come into their own when we look at fertility. Obviously you may do medical ones that you've already had done. You can also look at the female hormones differently other than just blood tests. You can actually do a saliva test which will map estrogen, progesterone and also measure testosterone over a whole cycle. So it gives you a picture of what's going over the whole cycle rather than just 2 blood tests on 2 different days in the month. And interestingly, a lot of work now on vitamin D. So I would suggest for the woman and the man that you check for a vitamin D deficiency. It can be done with a simple finger prick test. It not only can help you get pregnant, but for the woman it can help you maintain a pregnancy. So really important. Check you've got enough omega-3s by looking at the omega-3, omega-6 deficiency test, so you've got the right balance. And then if you need any other additional ones, you're thinking of a semen analysis and an ovarian reserve, what we call AMH, anti-Müllerian hormone. But the key ones in terms of checking that you're not deficient in anything and making sure that the vitamin D levels are good, your omega-3 levels are good, and putting all of that in place can give you a good chance of either conceiving naturally or boosting your success rate at IVF.
If you would like more information about this topic, then read below where you will find more help and advice to guide you through this health problem.